Positioning Lesson 11 is skull and facial bones. 15 minutes covering all the reference lines, the major skull projections, facial bone views, mandible, nasal bones, orbits, and all 4 paranasal sinus views. Skull positioning is systematic. Once you know the reference lines and CR angles, every view follows from the same framework. Skull positioning is built on 4 reference lines and a set of specific CR angles derived from them. Reference lines. The orbitomeatal line, IOML, from the external auditory meatus to the outer canthus of the eye. This is the standard baseline. The infraorbitomeatal line, IOML, from the EAM to the inferior orbital rim, 7 degrees below the OML. The glabellomeatal line, from the glabella, the forehead between the eyebrows, to the EAM, and the acanthiomeatal line, from the acanthion, the base of the anterior nasal spine, to the EAM, key CR angles. Caldwell PA, 15 degrees caudal from the OML, waters, OML at 37 degrees from the IR plane. Towne AP, 30 degrees caudal from OML, lateral, perpendicular to the MSB, submetavertex, IOML parallel to IR. Technical setup, KVP 70 to 80 for all skull views. Ishe, 40 inches. Grid required. Small positioning errors cause significant geometric distortion. Precision is essential. 5 projections. PA skull Caldwell method. Patient PA, nose and forehead on the IR. OML perpendicular to the IR, CR, 15 degrees caudal. Demonstrates the frontal bone, orbital superior margins, cristagalli, and lesser wing of sphenoid. Key finding, petrous ridges project into the lower 1/3 of the orbits. With 0 degree CR, no angle, petrous ridges fill the orbits entirely. AP axial, Towne, or half axial. Patient supine, OML perpendicular to IR, CR, 30 degrees caudal from OML, or 37 degrees caudal from IOML, center to the glabella. Demonstrates occipital bone, foramen magnum, posterior clinoid processes, dorsum celli, petrous pyramids, and zygomatic arches. The primary view for occipital fractures. Lateral school. Patient lateral recumbent or upright. OML parallel to IR. CR. Perpendicular to a 0.2 inches superior to the EM. Demonstrates sella turcica in profile, anterior and posterior clinoid processes, pineal gland if calcified, and orbital plates. True lateral. Both orbital roofs must be superimposed. Submetavertex. SMV, base of skull view. Patient supine with neck hyperextended until the IOML is parallel to the IR. CR, perpendicular to the IOML through the skull base. Demonstrates zygomatic arches free from superimposition, petrous pyramids, ethmoid and sphenoid sinuses. Primary view for suspected zygomatic arch fracture. Waters, Parietoacanthial for facial bones. Patient PA, chin extended until OML forms a 37-degree angle with the IR. CR, perpendicular, exiting at the acanthion. The primary facial bone view demonstrates maxillary, zygomatic arches, orbital rims, nasal bones, and maxillary sinuses. Modified waters, OML at 55 degrees, demonstrates the orbital floor for blowout fracture evaluation. Mandible views, axiolateral oblique. Patient lateral, CR 25 degrees cephalic, demonstrates the mandibular body and ramus on the elevated side. AP axial, chin elevated, CR 30 to 40 degrees cephalic, demonstrates the symphysis and body. PA, OML perpendicular for general overview. Temporomandibular joints, TMJ, open and closed views taken for each joint. Lateral or PA oblique position. Open mouth, demonstrates condylar translation forward in the glenoid fossa, normal condyle movement. Closed, condylar position at rest. Panoramic, panorex, the rotating beam system that captures the entire mandible and dental arch on a single image in one rotation. Orbits, Caldwell PA, superior orbital margins and walls. Waters, orbital rims and floor. The primary view for blowout fracture. Modified waters at 55 degrees, specifically for the orbital floor. Nasal bones. Lateral. CR perpendicular to the nasion. Demonstrates nasal bones in profile. Most common projection for nasal fracture. PA. CR 0 degrees shows the nasal septum. Tangential view. CR schemes the nasal bone surface to show displacement. For sinus views, each demonstrating specific sinus groups. Caldwell, PA, 15-degree caudal. Frontal sinuses clearly above the nose. Anterior ethmoid sinuses in the medial orbit region. Ordered first for sinus survey. Waters, IOML at 37 degrees. Maxillary sinuses, the clearest view. Teardrop shape projecting below the orbits. Air fluid levels in the maxillary sinus are visible when the patient is upright. Horizontal beam required. Lateral sinuses. All four sinus groups superimposed in profile. The sphenoid sinus, best seen on lateral, located at the center of the skull base. The lateral is the view where sphenoid sinus is most clearly identified. SMV, Sphenoid sinuses axially. Ethmoid sinus is visible. Zygomatic arches free. Technique. KVP 70 to 75, slightly lower than skull to maintain sinus air tissue contrast. All sinus views, upright preferred, demonstrates air fluid levels. The beam must be horizontal to visualize fluid levels. The table on this slide summarizes 5 key findings in which view demonstrates each best. Waters, maxillary, orbital rings, zygomatic arches. Air fluid level in the maxillary sinus indicates either fracture or infection. Modified waters at 55 degrees, orbital floor, the blowout fracture view. The teardrop sign, orbital fat or inferior rectus muscle herniating into the maxillary sinus, is the key finding. Towne AP axial, occipital bone, zygomatic arches projected free of the skull base. Lateral skull, celaturcica in profile. Linear vault fractures, sharp lucent lines crossing the calvaria. Tripod fracture, the most common complex facial fracture, 3-point zygomatic fracture involving the arch, orbital rim, and lateral maxillary wall. Requires waters plus SMV plus Towne for full demonstration. 3 skull and facial bone questions. The answer is C. IOML at 37 degrees from the IR plane, chin elevated. The water's projection requires the chin to be elevated until the orbitomeatal line forms a 37-degree angle with the IR. This positioning lifts the petrous ridges below the maxillary sinuses, providing the clearest view of the maxillary sinuses and orbital rims free from petrous superimposition. The answer is C, sphenoid sinus, best seen on the lateral projection. The sphenoid sinus is located deep at the center of the skull base. Because of this location, the Caldwell and Waters views cannot isolate it. Overlying structures obscure it. The lateral projection places it in profile as an air space at the skull base, which is its characteristic location. The answer is B, 30 degrees caudal from the IOML. The Towne AP axial uses a 30-degree caudal angle from the orbitomeatal line, directed toward the foramen magnum. This projects the occipital bone, dorsum celli, posterior clinoid processes, and petrous pyramids free from anterior skull superimposition. It is the primary view for the occipital bone and posterior cranial fossa. Lesson 11 complete. Reference lines IOML and IOML, CR angles for Caldwell, Waters, Towne, Lateral, and SMV. Facial bone views including mandible and TMJ, nasal bones and orbits. All 4 paranasal sinus views with which sinus each demonstrates best, and facial trauma, including blowout fracture and tripod fracture.